Assalamu alaikum. As mentioned, I'm the CEO of Primary Healthcare in Dubai Health Authority, but I'm not here to talk about healthcare in Dubai. I'm here to talk about actually the Noor Dubai Foundation. That's another organization that I'm very honored to manage, and I've been managing it since its inception in 2008. Just to give you an idea about all the topics and all the items that I'm going to cover today, we have the agenda here. So I'm going to start by giving you an overview about all the charitable work that the UAE is involved in since we were announced to be the capital city of charities or charitable work in the world. And then I'm going to go into how we manage our projects and our programs in Noor Dubai Foundation, and then the results that we ended up with and the achievements from managing those projects. So if we look at the overall funding that the United Arab Emirates provide for the development, either inside or outside the UAE, all the support that they get is around 22 billion dirhams. That is until 2013. Now 19.1 billion dirham comes directly from governmental funds. And we can see that 91.2% comes from different government entities, and 8.9% comes from the Abu Dhabi Fund for Development. And if we look at where is it distributed around the world, we see that a large chunk of it goes to Africa and Asia, because these are the countries of need around the world. Now we are still talking about the direct funding from government entities. If we look at all the programs that they specialize in, we have the general program for assistance, that is the response to any call for support. We have the mineral resources and the mining, the infrastructure development, and I think here we're talking about the roads and the bridges, and the transportation comes later on, and we've got the health sector. That's the fifth most funded activity around the world by government. Now, if we look at the charities that are in the UAE, we're blessed to have so many registered charities in the United Arab Emirates. These are actually non-for-profit, non-governmental organizations that provide support to countries in need outside the UAE, and they also have programs within the United Arab Emirates. Some of them are governmental entities, but they provide some charitable work. Noor Dubai started in 2008, and if you look at the ranking in 2012, we are right in the middle, and the ones that are above us have been established for years. So we're very proud of this achievement, of the work that we're doing and the support that we're providing. Again, this amount is the value of the support that we provide to different countries. So if we go back to the Noor Dubai Foundation, as you all know that His Highness Sheikh Mohammed bin Rashid Al Maktoum, he launches a humanitarian initiative every year in the holy month of Ramadan. In 2007, it was the Dubai Cares initiative that took care of education around the world. In 2008, it was Noor Dubai. And the reason why I mentioned those two, because it's very rare that you find specialized charities. Usually charities, they have different programs and they work in supporting the infrastructure, healthcare, education. They're more of a general support to a specific country. But with Dubai Cares and Noor Dubai, we specialize in one thing. And with Noor Dubai, it is not providing healthcare, it is providing prevention of blindness programs. So that's how specific we are. Our work is divided into three categories. We either provide direct management of disease by providing surgeries and medication, or we provide preventive care. We actually prevent diseases that can lead to blindness if the problem was not tackled. Or we provide education and training. Now, if you look at how we work, we don't just choose countries randomly, and we don't answer to random requests. What we do is that we study the statistics that are provided to us by international organizations such as the World Health Organization, the International Agency for Blindness Prevention, And we analyze them with those organizations because we benchmark with other charities. We put an action plan and the objectives, and then we see who should we liaise with. We don't work alone. Charity work should never be alone, and the solo charities are usually the ones that are not achieving much or spending too much money on organization. So we work with the governments of the countries that we go to, simply because we need our doctors to be licensed by those countries. And we work with local NGOs in those specific countries because they speak the language, they know the culture. If I was living in Pakistan or in Africa, in any country, and someone comes from a different country, they look different, they dress different, and they speak a different language, I wouldn't trust them with my life. It would take weeks until I start trusting them. So we actually use the local NGOs for their support. We implement the programs, and we have different programs in different countries, and then we have a monitoring, analyzing and monitoring reviews, simply because we need to know whether or not our work has had that impact that was meant to be achieved from this project. We go to different countries several times, mainly to provide the program and also to get the data from them. Now, we did mention that we prevent diseases. If you look at the first slide, there are 2 diseases that we've worked on. The first one was river blindness in 4 African countries. Now, river blindness is a disease that spreads next to rivers that have a very fast flow because of the insect that lives there. It's called the black fly. And if it bites a person, nothing happens to him. He just gets a rash like a mosquito bite, and he stays healthy for 20 years. So if a child who is 10 years old gets bitten by the fly, he has 20 years of normal life. After the 20 years, what happens is that the organism that was injected in his body through the bite dies, and it produces an inflammatory process that causes blindness. So you can only imagine, living in those countries, they're aware of this disease, but if a child lives there for his childhood and then moves to another country, and all of a sudden when he's 20 or 25, looking for a job, he turns blind. So the best thing to do with such diseases is to prevent the spread. There were so many attempts by the World Health Organization to actually eradicate the fly by putting insecticides in the river and treating the land. But then they were facing another problem, that the crops were dying, the cattle were dying, and these are the main resources for those countries. It didn't work. So they went back to the doctors. And us as doctors, we treat river blindness by actually preventing its spread. There's a medication that should be administered once a year. So every patient living in an endemic area should take 1 tablet per year for all his life, or for the rest of his life. The tablet is provided free of charge from the company as part of their support to the program. The cost here and the work and the effort goes into making sure that every single person actually takes the medication. So we mobilize groups in villages, in cities, mainly locals, Ministry of Health employees. They're trained and they're given specific tasks, and that's where the challenge comes, because you're not there to monitor, but you rely on the government to monitor for you. Our monitoring is usually reporting every now and then, but we're not there to actually see every tablet goes into someone's mouth. But thank God the program is extremely successful, because we find a lot of support from governments. And this is the same issue with the other disease, which is the trachoma. The trachoma is a little bit easier to tackle because it is spread by the poor hygiene, flies, wiping the eyes with dirty hands, being around infected people, sharing towels. So here, it's not distribution of a medication, or it's not primarily that. It is actually spreading the awareness. If you tell someone that you will get sick if you share a towel with a sick person, then they won't share it anymore. So they just need to be educated. Part of our work with the trachoma is also building clean toilets. We go to cities or villages where there aren't any toilets. They just use the house, the same room that they sleep in, the same room that they eat in. And this was a major problem, changing the lifestyle of people, changing the mentality and changing the way that they live. That was a big challenge, but thank God with the help of the ministries of health, with the help of other NGOs, this program is currently running. It's for 3 years in the northern area of Ethiopia, and it's extremely successful. When it comes to the treatment part, this is where we provide direct support to people in need. We go to villagers and we actually provide health care. We provide them medication, we provide glasses, and we provide surgery. We call them the mobile eye camps because we move with our operating theaters and our staff from one country to another, providing free surgeries. And the good thing about prevention of blindness is that the #1 cause for preventive blindness around the world is cataract. And cataract is a disease that you can treat by surgery, but it's a simple surgery if the surgeon is capable of performing it well. It's a 4-minute job under local anesthesia. So you don't need a big hospital, you don't need big machines, they're small machines, and you need a surgeon, and he can treat up to 100 people per day in a camp, not in a hospital. In a hospital, it's usually just 12. The education part, we actually do it in 2 ways. We have the public awareness campaigns where we go to villagers and we teach them how to prevent blindness, and we make sure that they actually implement the advice in their lives. And we have the training of the medical staff. And when I say medical staff, I don't mean only doctors. We train nurses, we train health supervisors, health aides, because they're the ones in their countries who are going to run our programs for us. Now, when we look at the growth strategy of Noor Dubai, as I'm talking to you, you'd think Noor Dubai existed for years. Well, no, we are going to celebrate our 5th anniversary next year, inshallah. When we first worked on the strategy, prevention of blindness blindness is a major disability. It is, because you won't notice how devastating it is until someone actually tries it. Hopefully nobody ever tries it, but living your life and seeing the world around you, and then all of a sudden it's taken away from you. You can't find your way, you can't work, you can't go to school, you're disabled. You have to depend on someone else, and in those countries, that someone else is usually someone who's providing support for the family. So then you have 2 family members who are sitting at home supporting each other. So you can only imagine what happens to the socioeconomic level of that village or that city or that country. So it's a burden, it's a financial burden, and it's a developmental burden. People are not developing with this disability. So we thought of tackling it through different ways. We have the new countries where we provide the same programs, but in different countries that we haven't been to. And this is usually depending on the latest statistics from the World Health Organization. For example, if there was an emergency or war in a certain area, and after it's over, they need medical support because a lot of people couldn't get the health care that they need, or they went blind from injuries. So we consider them as new countries, and we provide the same programs there. Or we can stay in the same country and provide the same program, and that's what we do in, for example, in Yemen and in Pakistan. The reason why we do that is because Pakistan counts for 4% of the blindness worldwide. It has a very high rate of blindness, and it is all prevented. It is all treatable. 80% of blindness is treatable, but they don't have the means to treat it. So we end up going 2 or 3 times to Pakistan to provide our services. We also have new services. Like last year, we introduced a new program with the Carter Foundation to tackle another disease, and it has been very successful till now. We're also thinking of going beyond vision. Beyond vision means we are not anymore involved in preventing blindness, but we will still stay within the healthcare sector. So this is also in our strategy. Now, when we talk about blindness, we know that 90% of the visual impairment around the world is in developing countries. Now, if you look at the map, the orange bit is developing countries. Fortunately, the UAE isn't, but because it's so small in the map, you cannot see the blue dot there. But why are they considered developing country? Because they do not have the primary care. When you look at the health sector is divided into primary health care and then the hospital sector health care. And the hospital sector or the referral centers is where all the surgeries and all the, the diseases are being treated. But the primary health care is where all the prevention occurs. So if you don't have the prevention and you don't have the doctors to treat, then you will end up facing the same problem, which is disability from different diseases and blindness. Now, the solution for this problem is to make healthcare accessible, increasing the number of health advisors and health educators, letting them move into the community and educate people, and training the medical staff. We know countries where the entire country has just one eye doctor and who is not trained well, just one. And this one person is supposed to treat the whole population of millions. It doesn't work that way. So we need to work with them on establishing a training program for their doctors. So this is one of the things that Noor Dubai does as well. Another issue that we faced is with the prevention of blindness is the inequality in providing healthcare in certain countries. Now, 64% of blindness around the world affect women, not because they're genetically predisposed to the diseases, but because of different factors that those women have to go through. It's cultural, it's behavioral. But if I tell you the stories, for example, in Asia, if a lady becomes blind or develops a disability, in some villages, not in all the countries, but in some villages, they think that this is evil spirits, black magic, sihr. Yeah? So what they do is that they isolate her. So she is visually isolated and socially isolated. We met a lady in one of the countries who told us that she was locked up in a room because she lost her sight. And being locked up in a room, we were talking to her because we didn't want to add to her, to her sadness. But we were asking her, how did you manage? She said, I was feeling fine because every morning I'll hear my children walk to school and walk back from school, so I know they're fine. If they go to school, then they're fine. They're not sick. So that's what kept her going on. And the funny thing there is that even when we go to these countries and we provide free health care, the husbands or the fathers or the brothers, they will not bring them to the hospital because they're too scared to go into the room. They won't open the door. So they keep them locked up, although we're providing the free healthcare service. That's why what we did, one of the solutions is to actually go to them in their homes. That's a picture of one of the Noor Dubai employees where we enter into the houses and pull up those women to treat them. Another problem that's predominantly in more African countries, they think it's more worthwhile treating a man than a woman because the man provides for the family. So when we go there and he has to transport two people, and we saw that actually, he would bring the boy but he won't bring the girl because he can only bring one person at a time. So it's better to take the boy and leave the girl. She might get a chance later on. And this was another problem. So what we do in most countries is that we go to their houses. We don't just stay in the eye camp. We actually enter the houses, we knock on the doors. We use the locals because they speak the same language again and because they look like them. So they're trusted. We spread awareness within the communities. We sometimes go for religious ceremonies, weddings. We go to mosques and we announce that we're coming and we're having doctors with us. So if anyone is interested, please join us if you know someone who's blind. And you'd be surprised because they want to help each other. We once had a situation where a young child actually brought in an older man from a different village and he had to walk for 4 hours to reach to where the camp is. But the boy actually walked to him, brought him back to the camp and made sure that he's fine. They want to help each other, they just need to be informed about the services that we provide. And we also employ women. When a lady is sitting alone at home and someone comes to her and tells her there is hope, there is treatment, so you can be treated, the effect is much more positive if she hears it from another lady. It's an emotional thing. So they trust them, they listen to them. So we're always educating other women to go and to help us with spreading the word. Now, prevention of blindness and poverty in the elderly population. When we first started, we were getting a lot of calls, why are you concentrating on old people? Why aren't you treating young people? Well, the answer is simple. It is, we are an aging population. We're all going to grow old. In the 40s, people were living until the age of 50 in the United Arab Emirates. Now they're living until the age of 80 and 90. So if we don't treat disability in elderly, we're going to end up with half of the population becoming blind in 20 years. So we have to tackle this problem. And the diseases that affect the older generation or the older population are easily treated, and that's the cataract. I'll go fast through the presentation because someone is pointing to me that I have to stop. Anyway, these are the achievements of the Noor Dubai Foundation. And if you look here, we started 4 years ago and we managed to help 23 million people around the world. Now those 23 million people did not receive direct surgery, but they are the people who were supported by the Noor Dubai Foundation, either through providing treatment, surgery, medication, screening programs, awareness, training, and you can see all the countries that we've been to in those 4 years. Some of the countries we've been more than once, and others we've just visited once because of a certain program that was there. But our work has been successful ever since, and we hope that we will continue in the same pace. Thank you very much.